Wonderful. Thank you so much, Ellie. And we are at 1 o'clock, so obviously we'll allow people to join, but the session is being recorded, so you will be able to catch up on it. So huge thank you for joining us this afternoon. And just a couple of points as well that I'd like to make, but we've got such an action-packed agenda that you can see on screen. It has been sent out. So all of the speakers this afternoon are so enthusiastic for this first CNIO webinar. So the slides will be made available, and like I say, it is recorded, so by registering you will get the recording. And as Ellie mentioned, please put any questions into the chat. We'll try and answer them as we go along. And then at the end, my colleague Ronki is going to run through some questions that we can put to the team. So hopefully we will keep to the tight agenda that we've got, because we've got so many speakers as well. So it is my pleasure to introduce and hand over to England's Chief Nurse and Information Officer and the Director of Digital Clinical Safety, Dr. Natasha Phillips. Thank you.
Helen, thank you ever so much. And yes, I'm very excited for this, our first of our NHSX CNIO webinars, but of course, not the first nursing webinar that NHSX has done. We know how valuable the Digital Nurse Network webinars that you so expertly led during the height of the pandemic were, in terms of supporting the profession. And so really taking a lead from that, we think it's really important to continue with some webinars as we move our national agenda forward, which is why we start off with this webinar, our first hosted by NHSX Nursing since April today. So if we can go to the next slide, please. This is our team. You can see, so since I joined NHSX in May 2019, the team has grown as we start to become a much wider voice for the whole of the profession. So Helen, you know, as one of our forerunner nurses, along with some other nursing colleagues in NHSX, was really holding the fort in terms of a voice. But bringing this national role now means that we can coalesce that voice into one strategic voice. And it's important that these sorts of webinars address all parts of the profession, which is what we aim to do with our strategy, and hence the breadth of our team that you'll see here today. And you'll hear from everyone on this slide today talking about different elements of the work that they are doing, or using their expert facilitation skills to support our collective conversation. And we're really keen that we hold some time at the end of this webinar to ask questions. So do post them in the chat. The team there are poised to answer in the chat where they can, but Ronke will be facilitating a Q&A at the end of all the presentations we have today. And I know she'll be picking out some key meaty questions for discussion as we go through. So I am going to go on to the next slide and just remind you of the context that this pressing nursing agenda sits within. So this slide talks about NHSX's overall strategy, which is to digitize individual services and then connect them to support integration, and through that enable real service transformation. And we're doing this in the context of digital transformation that's been happening over many years, but has certainly been accelerating, particularly since the WACSA review back in 2016, and that subsequent TOPOL review that talked about the shape of the workforce. We saw the RCN get on board with the Every Nurse an e-Nurse campaign, really talking about this agenda being every nurse's responsibility. And that's translated through to the long-term plan and the people plan, where we see real opportunity for our professions to contribute to this really important agenda, because those very much focus on our people and on the need through the emergence of ICSs and other mechanisms and systems and structures to make sure that we join up care seamlessly across the system, supporting patients' pathways throughout. And of course, nurses have some very special expertise in this area, which is why it's really important that we are at the table of key decisions around how we digitise our healthcare system. So if I move on to the next slide, I think this slide just encapsulates, probably more succinctly than I've just said there, why we as a profession are critically positioned to do this work, and why it's really important that we individually and collectively bring our leadership to the agenda to make sure that we have nurse involvement water board, ensuring safe, effective, efficient care with a workforce that enjoy coming to work. That's one of my key priorities, and that we have a sustainable future going forward. So an absolute key role for me, my team, and all of you together. This really can't happen without us. And so I call all nurses, wherever they work, to take action on this. And my commitment is that my team and I will work on creating the environment to enable you to do so. And we're going to tease some of that out through the information that we're going to share with you throughout this webinar. So if I could go on to the next slide, please. What we've done so far. So we're working across 4 key areas underpinned by a strategic approach. So if we think about the strategy, we've got some key pieces of work thinking about defining what good digital transformation looks like for the profession, so that our chief nurses and decision makers can support individual nurses and the wider profession in their organisations. We're doing some key work around leadership, and the key focus for us is using mediums like this and many, many others to create a networked nursing leadership community that's able to support the wider profession, really building our expert nursing community and using all sorts of networks to start to contribute to the conversation. Leadership at all levels. Education, establishing a plan of work that addresses the digital competency of all nurses, from undergraduate all through postgraduate. So all nurses having the digital skills, competencies, capability, feeling confident to work with digital, but also seeking to invest in those nurses who choose to be digital nurse specialists, and making sure that there's a real career pathway for those individuals so they can support the wider profession in this agenda. Our next pillar of work is around practice. So how are we making sure that nurses have the right technology and access to the right data to advance clinical practice? And we've got some key work happening in that area that we'll talk to later. And finally, we really need to think about research as well, and establishing a plan of work that ensures information about nursing care can be used for secondary purposes, be those secondary purposes managing services, managing a patient pathway, through to generating an evidence base and building our evidence base for our clinical practice, all the way through to building on that for artificial intelligence. So we can see it's a massive shift that we need to achieve across those 4 domains of advanced clinical practice. And this won't be a year's worth of work. This is a long-term piece of work that we all need to embark on together. And if we can go to the next slide, please. I think what we need to hold dear to underpinning that is the why. And for me, those are those 8 design principles. So what does good look like? To me, currently, it looks like joining up care for patients, empowering our staff at the front line, the professionalising nursing informatics, really reducing that burden of documentation that we know is very heavy on nurses, who are the heaviest users of digital technologies like EPRs, in order to invest time back in the patient, improve the safety of the care we give her, and make the care really targeted, supporting good decision making with empowered patients at the heart. So that's the vision for where we want to be. We will deliver it through addressing those 4 pillars of advanced clinical practice in our strategic approach. But first, we needed to understand widely where we are across the whole system. So if we move on to the next slide, I'm going to hand over to Holly, who's going to take you through that, because back last year, we did a survey to understand where we were in the digital landscape. We published those findings, I think it was about April, with those underpin our work moving forward. And we think it's really important just to take time to share with you what we've learned, the big questions that we've got left, and how we're going forward. So I'm going to hand over to Holly, who's going to talk you through that exercise so you can understand the exercise itself. Holly, over to you.
Thank you, Natasha. Next slide, please, Esther. Thank you. So as Natasha mentioned, earlier this year, we commissioned a piece of work as we started to look at identifying what digital leadership looks like kind of within the nursing profession at the moment. And that initially was broken down into 3 parts. So we had a literature review to look at current guidance that was out there, a series of interviews with digital health thought leaders, and as Natasha mentioned, a survey which garnered 157 responses spanning the 7 regions. Now, as you'll see from our map, we've not got kind of that level of organisations on there, and we do recognise that there are some limitations to this initial survey. So this is actually a snapshot of what it looks like nationally at the moment. But what we were able to identify through the findings of this survey was some core themes that we really needed to pin down and focus on, and also a series of big questions that we still had to answer. Next slide, please, Esther. Thank you. Now, I think it's really impossible to mention digital and nursing in the same space without mentioning the impact of COVID-19 and the effect that that has had on digitisation. So we all know that there's been a vast uptake in digital technology, and that's had a massive impact on nursing practice in the past year, from our remote wards to our remote monitoring services as well. And I think as nurses, this is really our time to come together and to unite and to recognise that we're the largest workforce working across the NHS and social care, we're the primary deliverers of direct patient care and also the predominant handlers of tech and data as well. So really it is imperative that at this time nurses are at the forefront and leading digital transformation across the NHS and are really pushing that agenda forward together. Next slide, please, Esther. And the next one. Thank you. So you'll notice as we take you through the findings of this discovery that we split it down into 4 work streams, and these very closely mirror the work streams that Natasha alluded to earlier. But what I'd really just like to touch on here is the interdependency between these. Our primary focus initially is to really get that great foundation of leadership and that golden thread. And that's something that's then needed to influence education, which in turn will then go on to inform practice and eventually inspire innovation and research. And what this moment is, it's really a time for us as nurses to take ownership of our profession, to be able to have a view over that in terms of data, to be able to push forward technology in order to give better care to our patients, and also just securing the future of nursing as a profession in the digital world as we continue to push forward. I'm now going to hand you over to our Deputy CNIO, Sarah Nelson, who's going to take you through some of those core findings we found as we looked into leadership.
Thank you very much, Holly. So from a leadership perspective, as Holly described, we know that we need great leadership to support us in the establishment of a culture of education and development, allowing us to be more confident and informed. Our leadership needs to inform our practice. It needs to ensure that future research and the support and implementation of innovation to improve that nursing care for our patients, but also the working lives of our staff. The Digital Maturity Survey did prove some interesting variations that we'd previously suspected, but not actually evidenced, and I'll update you on some of those now. There were variants in career progression around revalidation, supervision, reporting lines, and job descriptions. It was revealed that while some organisations have multiple digital nurses, others only have 1. There are fewer digital nursing posts in Agenda 8B and below, 8B and above than there are below that level. So we have a variation in our levels of our digital nurses. Contributors also voiced concerns around the lack of a really senior nurses at board level and in that development of the strategy. There was a feeling that historically, nurse leaders haven't been invited to take part in organisational discussions around the strategy and those digital discussions. It was felt that nurses had generally been passive recipients to technology and systems and hadn't actually been part of the decision-making processes. Whilst participants noted that wider nursing leadership responsibility associated with the CNIO role, they also emphasised key leadership implications for digital transformation, identifying the opportunity to broaden the digital strategy within the nursing workforce and building strong relationships between IT, clinical and operational teams. Contributors did, however, report that they enjoyed strong communities of interest and networks that would benefit from the light touch from the national level and central organisations. Networks specifically help nurses to become early adopters in a digital, because nurses often find themselves feeling isolated and sometimes unsupported by managers. We asked respondents which networks they belong to, and by understanding the networks that are available, it's really important to allow the membership and links to the current work that's being done. Knowing this information has allowed the opportunity to drive forward these networks, and we will hear from two of them later this morning or this afternoon. One will be from the Regional Digital Leads, and one will be from the Shared Professional Decision Making Council. Next slide, please. So the big questions that we're asking around leadership: how do we define the role of the CNIO and ensure that the capabilities and scope of the role are discussed whilst we align them to national level guidance, roles and responsibilities? What we need to do to work with our regional leads to develop that culture and the shape of what the digital nursing teams will look like, so we have that dynamic group of professional leaders that will be able to support both the digital and wider professions. And ultimately, we want to be able to influence at senior level, ensuring that digital nurses have input at board level. It is indeed an exciting piece of work at a really key and interesting time in nursing practice. Thank you, and I will now hand over to, I believe it's Tracy.
It is, yes. Hello everybody, I'm Tracy. I'm the Programme Lead at HEE for Education, and I apologise for the voice, but I will do my best to get the message across. So, education core themes. It was really obvious that digital nurse posts are not standardised and there isn't a clear pathway for career progression. There was real disparity in the makeup of the teams, so we need to look at how we can move that forward. We highlighted that digital health isn't embedded into the undergraduate curriculum. We've talked about postgraduate and taking it all the way through, but we need to go back and make sure that newly qualified nurses have the skills and the knowledge that they need to be able to practice safely and professionally. The other element of that is that the entire workforce needs to be upskilled, whether that is those newly qualified nurses or the experienced nurses where digital is new to them. So we know that we've got organisations out there who are still on paper and are going to be going through a transformation programme in the next few years. We need to have the ability to give them the skills that they need. And then that takes us through to the digital nurse specialist. So the nurse that has chosen to take this as their specialism, and looking at how we professionalise that role, so it becomes another recognised specialty. The specialty workforce need to be in a position to support the wider workforce, especially with the reports that we've got of that isolation. But as Sarah mentioned, it's more important than ever now that with ongoing clinical pressures that you take the opportunity to join any networks you can. It's a really good resource to get involved, get supported and learn and talk to others who are in the same position as you. Could I have the next slide, please? So the big questions. It's still not clear what those fundamental skills are. It's clear that we need to look at competencies and capabilities at each stage of the career, identify what the education offerings are to match them in so that you can see on that structure where you are and what you need if you want to progress towards specialty. How do we inspire and upskill that large workforce? We need to look at how can we baseline all education opportunities to understand how we can embed those digital skills into both the undergrad and the postgrad. And again, it's about that digitally enabled, so somebody who chooses to practice with patients frontline, the skills that they need to be able to deliver care and use the technology and the systems available to them to deliver that care through to those who choose to specialise. Work is ongoing to ensure that these elements are fully represented within the work streams that you're hearing about today. It's also been informed by our regional leads and the education advisory panel that we're currently setting up. With this in mind, the leadership and education work streams are driving force to ensure that nurses working in the digital world, whether that is that newly qualified or practicing as a specialist, are fully supported and can access the right education to inform and progress through their career. This is from me, a really brief snapshot. There's going to be lots coming, and I'm hoping in the future that we'll be able to have one of these webinars focusing on what we're doing in the education. So watch this space, and thank you. I'm going to hand over to Helen Ballston.
Thank you very much. So I'm Helen Ballston. I'm a Florence Nightingale Digital Leadership Fellow joining NHSX for the year. And I've got the pleasure of presenting the practice and research related issues that have become very apparent as a result of this digital maturity work. And you won't be surprised to see that what we very clearly saw was the variability, because of that variability, in digital maturity across the NHS. We have people working in highly advanced digitally mature organisations and those still working with a few bits of technology, most of which doesn't talk to each other. But we know that those working and have got that experience want to and should share that knowledge and skill to help those that are coming behind them. That issue of confidence is one that was very, very apparent in what we saw in the results, and how we can support people to go on that journey. And the networks are very much a key part of how we do that. Standardisation was an interesting one that came out in lots of different ways in the maturity work that we did. And we know from the conversations we've had since then, many hospitals that are going down a digital journey very much start the journey for themselves and reinvent the wheel. And there is an opportunity to do things differently that would help us across the healthcare spectrum. And that, of course, means that we play a role in that service transformation that we're all seeing as well. And that ability to influence it has become paramount. Next slide, please. So the big questions we were left with from that work is, what does the competency framework look like? So picking up on the work that Tracy's talked about in the education work stream, what does that look like? How do we grow those nurses, and not only grow them, but give them the skills, the knowledge as they go through that journey? And that's people at very grassroots level right through to the experienced nursing informatics specialists. So we need something that's going to meet everybody's needs, no matter where you are on that spectrum. But also looking at how we can standardise some of those elements of our day-to-day clinical practice. And I'm delighted to say we've just set up our practice work stream that's really trying to explore that, working in partnership with the PRSB, the Professional Record Standards Bureau, looking at what is nursing documentation looking like across hospitals, community and nursing homes, and what could we do to make a difference so that we could go smarter, faster collectively to give that patient the great care that we could. So early days, but really exciting. But also, how can we use the knowledge and skills that we all have across our profession to really take those on a journey? I know when I was starting out, there was very few people around, and I was reaching across to the pond, you know, to the US to get some help. But now there's so many of us. Let's help each other on this journey as we drive things forward. Next slide, please. So in terms of research, digital literacy came out as one of those great things that could really be a barrier, but it could also be an enabler to help us really demonstrate that nursing contribution to care, so that we can understand what we do and drive to improve what we do all of the time. I think we all know the data is so important to inform, and we have some really interesting ways in which we know we're going to need to drive the profession forward, using great data to showcase what we do and how we do it. Next slide, please. So the big questions related to nursing that we came away from this service: how do we currently capture data represent nursing practice in real time? We know we've got many different programs up and running, unit accreditation, magnet, pathway to excellence, but all of them are really dependent on great data, and we all reinvent the wheel. Is there something more that we can do? But we also know we need to start much smaller than that and actually help all of us use great data, access it, understand it, to be able to interpret it and then present it back so that it truly does inform what we do and how we do it, to drive that patient care and really make it the best we can do, and use our networks then to share that information. And although that's one of the core issues that applies to all of us at any level of nursing you may come into, we also need to support those working in research. We've got a really small number of people working in nursing informatics in academic roles, yet we all know the power of data, and we're going to be a data-driven NHS across the next 10 years, or so the big publications tell us. So we need to support that workforce. How do we grow them? How do we make sure that we've got people coming on behind them, because they can help us really use the data, the evidence base, to drive us forward, both in the next 10 years and way beyond that. Next slide, please. So I'm now going to pass over to Jo, who's going to tell you about the next steps.
Thanks very much, Helen. Next slide, please. I'm delighted for a number of reasons to be contributing to this webinar this afternoon. I'm particularly delighted to be able to get the opportunity to summarise what my colleagues have already talked about. I think my attendance and my speaking at this webinar is really testament to the amount of collaborative working that we want to do and have started to do. As some of you might have noticed from Natasha's first slide with the photographs of us all on it, I don't work for NHSX. I'm the chief nurse at NHS Digital, which, as you will all know, is a different organisation, also working in digital and technology across the NHS. But we collectively feel that this agenda, as you've already heard from Natasha, is a big agenda, and we feel that it's really important that we work collaboratively on it. So that's why I'm delighted to be here as part of the team delivering this webinar today. So what is next? What we want to do, you've just seen the big questions from sort of looking at the chat that I'm seeing there on Teams. Lots of you are very engaged with the questions as they've come up, and it feels to me as though what people are saying is, yeah, these are the kinds of questions that I've been wanting to hear the answers to. So I'm seeing some support there from you guys on this webinar in helping to support us in answering those big questions that you've just heard about. What we also want to do as a team is establish what good looks like from a nursing perspective in the digital age. It's really important that we support CNIOs, but we also support nurses working in other digital roles, but also that we support chief nurses in understanding what the digital agenda should look like within their organisations. The nursing workforce is the biggest in the health service. The number that's on there, you know, there is some dispute about that exact number, but we are the biggest workforce. And one of the things that we want to collectively do is work collaboratively, as has been said. Holly's already said this is our time. I very much agree with that, because I think absolutely as a workforce, this is something that we should collectively commit to. But what we do want to do, and this is another thing that I'm seeing coming up in the chat already, is that there is lots of enthusiasm for working across organisations, for working across the sectors, for working both nationally and internationally, and also with existing networks in this space. We are, as a team, very committed to doing all of those things. So there's lots coming up, there's lots of what's next, and the key thing for you hopefully to take away from this webinar today is that this is not the end. This is the first webinar in what we hope will be a series of useful webinars for you, so that you can contribute to this agenda as a collaborative group as we move forward. I'm going to hand over now to Helen Crowther, who is going to pick up the next part of the agenda. Thanks, Helen.
Thank you very much, Jo, and how fantastic that we're actually ahead of the agenda, which will leave time for lots more questions as they come in the chat, so that's fantastic. Next slide, please, Esther. So I would just like to take this opportunity to let you know about the National Digital Shared Decision Making Council, and then, as Sarah mentioned earlier, that we're going to hand over to a couple of the Digital Council members, Lincoln and Louise, who are joining us today. The Digital Shared Professional Decision Making Council was established in August 2020 with colleagues from all the regions and a range of organisations where they work at point of care. The group of frontline nurses and midwives come together virtually to discuss new digital ways of working clinically in response to the COVID-19 pandemic. The pace of change were documented then into case studies, and this really demonstrated a wide range of practice and experiences during the pandemic and the ongoing restoration work that then members wanted to share more widely and ensure that others could also benefit. However, in the recent months, an emphasis has now been placed on using lessons learned, and this is to inform decisions about digital technologies and informatics for future nursing practice. As a result, point of care nurses have now created a ward-to-board vision, really exploring and mapping the scope of influence that digital nurse leaders locally, regional and nationally. The principles ensure that with agreement, this is reached in such an inclusive and collaborated way. And whether involving decisions that affect your day-to-day work, or with teams, or with concerning communities, or the wider organisations or the profession, by coming together in this way really underpins the relevant evidence base, and this provides us then with that really nice, strong, collective digital professional voice. Next slide, please. So the group set off with the Digital Minute in a Minute, and this is done each month. A different subject matter was talked about and a deep dive into those case studies. This allowed the opportunity for everyone to speak and present, and this was a new experience for many. And again, I'm sure that Lincoln and Louise will give you a bit more about that information. But it really often put people out of the comfort zones and really wanted for the adrenaline to kick in when they were aware that senior nurse leaders were also present. Over the pandemic, they brought in guest speakers, so from digital leaders to wellbeing, IG and comms. And last month, the members expressed their views on the word cloud. And we can see that even though of all of the challenges and the pressures that the nursing profession have had over this last year, it's really inspiring to hear that the group were proud, supportive and motivated. Next slide, please. So with 6 out of the 7 regions responding, the survey also found that 71% of the members had felt that the council had provided professional opportunity, and were really keen to develop this now regionally and really creating that ward-to-board vision and improving the local to regional to national vision. The responses that you can read on screen, but I just want to emphasise some of those key points: acknowledging resilience, confidence, dynamic, quality improvement, professional development, networking and improved patient care all around the digital agenda. One member concluded by saying that having the opportunity of chairing at a national forum, growing a network of colleagues and therefore understanding the wider digital agenda and its impact on the NHS. It's a great pleasure to hand over to Lincoln and then Louise to hear their personal stories. Thank you, Lincoln.
Hi, everybody. Can you hear me? Can everybody hear me?
We can indeed. Thank you.
Oh, yes. Thanks, Helen. So, wow, I'm super excited. I'm a student at Keele University. Just started my final year project. So I just want to give you a little bit background how I ended up being part of the decision-making council, the Digital Decision-Making Council. So earlier on in my second year, I basically decided that I wanted to volunteer so I can encourage young people to join the nursing profession, in particular learning disability nursing, which is what I'm studying. Really, my main focus, I wanted to talk to them about opportunities within learning disabilities, really, because the numbers are quite low in terms of recruitment. So I was basically asked by Keele University to go out there and really try and encourage young people who are coming up to join the nursing profession. So I was talking about technology really in general, because in learning disabilities, we use quite a lot of technology. So I wanted to just share my experiences of some of the work I was doing within the North Staffs Combined when I'm going on placements. So when I was on placement, I know during the pandemic, we have Office 365 really. We do have Microsoft OneDrive and all other applications, Power Automate, and all these things. So I was looking at these options and I thought, I need to train myself. I need to find out how can I work better when I'm on placement, because systems within the NHS, you've got the shared drive where you're saving the files, you're out on a visit with the patient, and you want to share information with the parents. You really can't do that until you come back to the office. But now we do have Microsoft Teams where you can share information, where you can communicate across different platforms. So I started building a Microsoft SharePoint site within the team so that they can access information. Obviously, in terms of security, Microsoft, you got the authenticator where, you know, you can get a code from your phone and then you can sign in. So I was thinking about that as well. So when I was talking during this presentation, I just started getting interested in artificial intelligence. Why artificial intelligence is really going to transform a lot of things. So I started building like a chatbot using Microsoft Automate, where I try to integrate a PBS pathway tool, because we do have a lot of pathway tools, but within the organization, how is staff accessing this information? So I started building a Microsoft chatbot where you can integrate it within Microsoft Teams, and anybody can find this information about positive behavioral plan. So I can share it within the chat group if anybody wants to see it. So my main really, so that's when, Helen found out and she sent me an invite, Lincoln, are you interested? So I was not even aware about this team. I was just a student who was really interested in technology. So I'm really super excited to be part of the team, you know, where I'm learning from different, you know, the diverse group of different skills and different things that are coming up. So it's really my passion to sort of like share my knowledge with other students, whether it be locally or nationally, about the importance of technology. Really, it is here to stay, and in particular, artificial intelligence is really about working smarter. So when I'm on placement, for example, how am I documenting my notes? You know, clearly you have to go back to the office, you have to type and everything. So I'm utilizing Microsoft OneNote, and it's been quicker. So my placement supervisor, like, how are you doing this, Lincoln? So I'm now starting to show other staff members on how to just really work smarter to get things done. So another last project, it's an article I was writing about Microsoft HoloLens. So HoloLens is like augmented reality, mixed reality, really. I was on placement and I'm looking at patients with different social stories. We all have relatives that we miss or we have passed away. So what if we can start building these environments, these simulated environments? People with learning disabilities, they don't really have opportunities during the pandemic to go out for disco or for things that they liked. So we could really build some of these virtual environments. So a patient can go on a disco or they can go for a simulated walk, you know, which might in the future might sort of like reduce some challenging behaviors that we're finding in assessment treatment unit. So I am just in the process of writing that article, really, just to try and explore my ideas around that. So this is where I found out our colleagues within the adult nursing, Microsoft, NHS have already started using Microsoft Teams during the COVID-19 pandemic, where doctors are wearing all these glasses to sort of like deliver patient care, you know, in terms of how contact tracing and whole COVID issues around that. So yeah, people with learning disabilities, we kind of sort of like, this is all critical, but, you know, we kind of like sort of like forgotten in terms of when new systems are coming in place. So that was my idea anyway, to just sort of like raise my voice. So thank you so much, Helen, for giving me the opportunity to be part of this team. And I would really look forward to engage constructively in different ideas that I have coming up. So thank you. I now hand over to Louise.
Thank you, Lincoln. I think it's the next slide. Brilliant. So hi, my name's Louise. I'm a digital nurse implementer at the Christie up in Manchester. I should sort of qualify that with I will not be a digital nurse implementer from next week. I'm starting my digital ACP training, and we think I'm possibly the first person to combine those as the two in the country. But you know, please do reach out to me if you're currently doing it, because lots of lessons to be learnt there. So I'm the current chair of the National Shared Decision Making Council. I joined as one of the founding members in August last year after an application process. I at the time remember thinking, I'm not sure what I'm signing up for, but it's, you know, anything to do with sort of bringing that ward to board ethics alive. That was where I wanted to go. I was working as a nurse in the pandemic at that point. You know, working in our haematology day unit, delivering frontline care, and I just felt like there was lots more that we could be doing for sort of digitally for our patients to sort of keep that connection a bit better. We'd already started to move digital forward through the pandemic, but you know, it was quite clear that digital was becoming much more of a thing through the pandemic. So once I started with the National Shared Decision Making Council, at first I had the complete imposter syndrome that everyone has. I wasn't certain why I was there. I thought, oh God, this is where have I got myself into now? Way above where I should be. But quickly, within the first two sort of sessions of the Shared Decision Making Council, it became really clear what we were driving forward here. You know, it was a community of nurses, and as Helen has sort of previously said, we did a lot of digital minutes where we all talked about quick, innovative ways that we could sort of make changes at pace in our clinical environments. And that was great. It helped us bring back different ideas to our different trusts locally. Some of the things that we sort of took forward was looking at different ways that we could communicate with our patients, different ways that we could interact with student nurses by providing virtual placements, different ways that we could care for our patients with different interpreters, and we started to build this catalogue of case studies and case notes to show the change. We have got representatives from each region, and it's been phenomenal to see the rate of change and the change across the regions nationally. And that is it from me. Thank you very much.
Thank you so much. Gordon, over to you. Thank you.
Hi, good afternoon, everybody. So my name is Gordon Elder, and I'm the regional CNIO for NHS CNI up here in the Northeast and Yorkshire, which was very sunny up until about an hour ago, and it's not very much now. Thank you very much for asking me to come and speak today. I have a number of roles. I'm an Associate Director of Nursing and CNIO for Newcastle upon Tyne Hospitals, as well as Regional CNIO for NHS ENI. And I also lead the Joined Up Care programme for the Regional Digital Transformation team. So I've got a number of fingers in pies. So it's really interesting role, and I'm very grateful to be able to say what we've started to do up here in the Northeast in Yorkshire. So one of the first things that we've done, and we've started to set up meetings with regional CNIOs and informatics lead nurses across our region. I knew a lot in Northeast and North Cumbria, but I didn't know very many in Yorkshire, and I've had the delight of meeting various people, Richard, for example, in Airedale, and this afternoon, Georgina from Leeds. So it's really important for us to pull that together. And going back to what other people have said, it is really interesting to see the diversity in the titles of informatics nurses, CNIO, deputy CCIO, IT nurse, various things that are happening across the different hospitals that we have. But it is great to pull all of these people together for us to start to share best practice and offer support. We've also started to set up meetings with the ICSs. There are 4 of them in the Northeast and Yorkshire, and also to get our presence known, to say, you know, we are informatics nurses, we're CNIOs, we are digital nurses, and we have a digital agenda. And to use one of Natasha's recommendations to me was elbow my way in. I have done that on numerous occasions, but actually there's been very little resistance. I've found that anywhere I've asked to meet, discuss what's going to happen from a digital agenda and nursing, people are very welcoming and are very keen to understand what we're going to do and what our plans are. We have regular updates with the regional senior nursing team, and that works really well because I'm able to update them and keep them informed about current projects, strategies, national strategies that are coming from Natasha and the team, and from Helen, who's my link here in the Northeast in Yorkshire. And we also have CNIOs represented in 2 of our educational forums, which is really important. And that's Lisa is from County Durham and Darlington, represents us as a region in those education forums which were predominantly medically led. So it's really, really good that we're getting in there and voicing nurses' digital agenda as we move forward. There's discussions happening on about how we look at clinical governance as a whole across the region, and we're having discussions with the regional medical director, again, getting a nursing input into that level of discussions with the senior nursing team. And also we're invited to the regional CIO group to discuss our role as well. So the Chief Information Officer is really keen to understand what we do, what we can offer in relation to getting nurses in at the highest level of design and decision making when it comes to clinical systems. Because just to reiterate what everybody says, more nurses than any other professional group, and we document a lot more. The other part of my job is also to link up regional initiatives from the Joined Up Care and from the ICS Cancer Network and local trusts. And just to give you an example, I had a fantastic meeting today with a project team in the Vale of York who have implemented a system with AI that predicts outcomes for patients with long-term chronic conditions. Absolutely amazing, some of the outcomes, and this is nurse-led. And they have reduced ED admissions, they have reduced GP appointments, and they do it through a method of nurse health coaching to patients. And really importantly, the feedback from patients has been phenomenal. Patients have really loved it. They've felt incredibly supported, and they feel much more confident to deal with their long-term chronic conditions. So this is something I think that we need to share potentially with this group, and absolutely a real flagship thing for nurse-led projects that we're doing across the country that none of us really know about. We also have excellent collaboration between CNIOs, and again, I will mention Lisa from County Durham and Darlington, where they're taking on Cerner, and we have done that in Newcastle. And it's about sharing our experiences, sharing anything that we can to make life a little bit easier and learn from our mistakes, basically, but also to provide that support. So it's about professional support and just sometimes somebody to go up and have a chat to and say, am I doing the right thing? Run something by something, really, really important. So we continue to build that network forward. And that's me. And I'm now going to hand over to Holly, who's one of our Florence Nightingale Digital Fellows.
Thank you, Gordon. Next slide, please, Esther. Thank you. So hi, my name's Holly. You've already heard from me this morning, but I'm a Florence Nightingale Digital Leadership Fellow sitting within NHSX, and I'm also a scholar in this year's Florence Nightingale Digital Leadership Cohort. So I just really wanted to use this opportunity today to share a bit of my journey and some reflections, and also some of the opportunities that are available for nurses who are digitally motivated or have a particular interest in pursuing a career. So as a bit of a background, I'm a paediatric nurse, and when I was around 3.5 years qualified, I started in the role as lead nurse for digital technology in one of the big children's hospitals in England. Now, initially, when I saw the advertisement, I thought this looks great. It's a bit of transformation, a lot of engagement, and chatting to a lot of nurses, which I love. And very quickly, when I entered that role, I realised that actually I needed some more leadership support. I'm sure a lot of us can sympathise or have been in a position where you're kind of sat at a middle grade and you're not quite at the point where you can reach board level yet and push from that point of view, and you're no longer quite accepted in the kind of general nursing group within the trust. And so it's really about influencing beyond the role that we have. After coming to this very stark realisation, I applied for the Florence Nightingale Scholarship and was offered the fellowship as a result. Now, my personal passions really centre around patient safety and also nursing, and what I like to call the nursing superpower, which is our intuition. And when I first started to explore digital, I was really interested in how we maintain that art of nursing in a digital world. How do we ensure that our voices as nurses and our clinical assessments are still being pushed to the forefront, and how can we use technology to influence those? When I started the fellowship, I shared these interests and was very aptly placed within the digital clinical safety team and also the CNIO team. So I work across the both. And I think really I could kind of share more about that experience, but I think 3 top reflections of my time so far, the past 5 months of the fellowship, are really learning who I am as a leader. So both in terms of as a professional leader, but also reflecting on my own capabilities and being able to build those. And also having fantastic mentorship, some of which started pre-fellowship and is carried forward, and hearing from some fantastically inspirational nurses and seeing exceptional leadership day to day. A second reflection is a view of that ward to board. So I was very much in the hospital universe beforehand, and having the ability now to look from a national point of view. One of the things I was really naively surprised, I think, to find was that we have the same conversations at a national level as we do at a local. And that for me was very reassuring in the sense that the pressures that we feel, there are also teams who are trying to solve that and trying to make it easy for us as well from a national point of view. And my third reflection really is what I like to call the Tupperware box theory, which is where as a nurse who was relatively new in my career, as I started to explore the digital landscape more, I saw that there was a definite career that could be had here. And prior to joining the fellowship and the scholarship, I had a big worry inside that this was maybe, you know, it was something that was really great in the moment, but is this something that would kind of box me in, or would this just be a specialty for now? And actually working with the team and seeing the work from some of the leadership assessments that we've done, pulling it all together, this really is, as I mentioned before, the future. The future of health is digital. And the future of the nursing profession is a digital one. And so actually having the opportunity now to be in a position where we can start to really empower the workforce. And I think as we think about the entire point really almost of what we do at NHSX is making sure that nurses have a profile and a platform to be able to make that change. We finally got our hands on the tools and have the potential to have our hands on our tools, which can give us the information we need to advance our own profession, which is something that I don't think we've had as readily in the past. And so I'm really excited to see the cultural transformation that will come from this, and being in a position where I can learn and observe as I go along and also be on the forefront of those exciting advancements is really phenomenal in this year. So just to kind of share a bit of information on how you could be involved or other experiences, you may have seen that the Florence Nightingale Foundation scholarships are now officially open. I think those applications run until sort of around Christmas time. And they are for the scholarships, and there are also going to be some further fellowship opportunities within NHSX that are going to be coming out towards the end of the year. So if you would like any further information, please feel free to get in touch. But I know that Florence as well are advertising theirs at the moment on their website. Thank you.
Thank you so much. So if we go to the next slide, please, just our contact details and how to get in touch and keep in touch with us. As you can tell, that there's so much exciting things that are happening. So it's important that you stay in touch so you know when the next webinars are, how to contact us on social media, how to provide any feedback. I'm now going to hand over to Ronki, who's going to lead the questions. And there's so many, Ronki, I don't know how you're going to do this at all. So good luck. Thank you.
Thanks, Helen. It's been incredibly busy, but it's been a really sort of healthy mix of questions and really good positive feedback from everyone, from ensuring that we're inclusive in joining up conversations across social care and the ICSs, to the data and the methodology used in the digital maturity survey, with a request to potentially share the report a little bit more widely. I think there was also a lot of emerging themes around digital competencies and capabilities, making sure that whatever we do, that it actually reflects the reality of the current day-to-day work undertaken by nurses. So that means wearing so many hats. But I think there was one from Siba Bongi, hopefully I said that right, from Emson and St Heliers, around what are our plans and how are we working closely with our international colleagues across the programmes of work, especially embedding informatics in advanced practice. So I think, would that go to Natasha?
Okay, thank you. I'm happy to pick that up, and I'll point to a few key members of our team who that touches upon. So I'm passionate about working as an international community of nurses, so passionate that I have joined the International Council of Nurses leadership program to really start to work with international colleagues. across a much more global view than some of the obvious candidates, which, you know, we often look across the pond to the US, but there's much more to be learned. And so we do have, we are setting up an international advisory panel that will inform this piece of work, and our team will bring specific elements to get that real international perspective and flavour into what we take forward. And that panel will inform the oversight board, which are our key leaders from professional arm's length bodies that will determine how we take this forward and have final sign off as a result of what we hear from yourselves. So yes, an international flavour, looking at both the what and the how. So in terms of the what, looking at things like how we might adopt a national nursing standard, develop a national nursing data set, learn from some of the different practices across all continents, really, in terms of bringing innovation into this workspace, but importantly thinking about our workforce as well. So we know that there are exemplars like in the US and in Australia where nursing informatics, as they call it, I think the term digital clinical nurse specialist probably resonates much more with us. And I saw that ACP conversation going on. So learning from the way they do it and bringing it to the UK to translate it into the way that we practice, and build really good career pathways for nurses at all levels who want to specialise in this field of nursing.
Thank you, Natasha. I think one of the other emerging questions that we had in the chat was around the role of a CNIO and maybe sort of like a dual role as a chief or clinical safety officer. And I think it's probably more a discussion and asking, should this be a dual role or should it be a separate role?
Would you like me to pick that up, Ronke?
Yes, please.
Okay, thank you. So I think they're two distinctly different things, but we have much to bring as nurse leaders to the space. Not least, you know, I am Chief Nursing Information Officer for England, but also as Director of Safety for NHSX, I'm the accountable CSO for our programmes of work. And so, you know, it's incumbent on me to make sure that our programmes are fully compliant with our digital clinical safety standards, but more importantly, that we have that digital clinical safety capability across the system. And that's been sort of outlined in the National Digital Clinical Safety Strategy that we launched on Friday on World Patient Safety Day. And Holly and other clinical colleagues were really vital in that. But what was really vital is they worked as an MDT. Holly was the nurse working as part of an MDT to engage other clinical colleagues from all clinical professions to developing that structure. I think the CNIO should be clinical safety trained, should certainly be a CSO. They may or may not be the accountable CSO in an organisation, much like the chief nurse may or may not be accountable for the wider quality and safety agenda in that organisation. So two distinctly different things, certainly something we're capable of, but I'm mindful, and I support Joe's comment in the chat, that we don't own it entirely, and in so doing, allow everybody to take 2 steps back. We've seen from the strategy development where it's been an MDT approach, the value of working as an MDT.
Thank you, Natasha. And I think we have just one more time, maybe just a minute to answer one last question around, for nurses who are who are on the program, on the webinar, or those who are listening or have a a copy of the recording, how would you advise, and this is for anyone, how would they get involved in digital research nursing or just across the spectrum of digital programs, or become a digital nursing leader?
Wow, there's a whole lot packed in there. I wonder if Helen, who leads for us on networks, picks up the answer in relation to how you get involved no matter where you work in nursing and the breadth of networks that are available. Helen Crowther, do you think you could do that?
Absolutely. I think the key points are that there is something for everyone. It doesn't matter if you are setting off with your journey in your nursing career, or if you've been a nurse for 22 years like myself. My daughters will say I'm not techie at all. I obviously think that I am. So I think that, again, the networks that are available, there is something for everybody, and it's just finding out who they are, what their objectives are, and how you can learn through them. So again, that's part of the work, and Sarah touched on that earlier, that we're doing as part of the leadership and education work stream. So I think using this forum, there's a webinar in itself to let you know those sort of details, but there is essentially something for everyone. It's just finding out what is for you and at what point in your career. Thank you.
Thank you, Helen. That would be it for me.
Thanks, Ronke and Helen. We could chat for all afternoon, I think, Helen. But in terms of our timing on the agenda, Helen, where are we and how much time have we got left?
We are literally at 2 o'clock, so we'll leave it there. Thank you so much. And if you would like to say some closing words before we all sign off, that would be great. Thank you.
Thanks, Helen. I'll be swift. I think it's clear from the breadth of conversation that the size of the agenda is vast, because digital touches all parts of the profession, and lots of asks in there about how do I get involved, which you've picked up on there. There's lots of asks from those specific areas. Our job nationally is to make sure all parts of nursing are served, and that's what we're really trying to do through a multiplicity of ways. And my call to everyone here is just seek it out, ask, use those contacts that we've put there, and we will try and direct you to the right place. But let's all use our passion for this to become a social movement, to really move towards a future of nursing in a digital healthcare system, and make sure that it works for us and for our patients. Thank you very much, everyone, for your time today.